Hello everyone, my name's Dr. Daniel Pone from Clifton Hill Chiropractic Clinic. I'd just like to talk to you all today just a little bit about health and wellness. So just to start, I wanted to ask you all a question. Now just have a little bit of thinking in your head. How long do you think we're designed to live for? So what would you do if I told you that human cells are programmed to live by nature for 120 years? So the reason I'm talking to you today is because I'm passionate about sharing the truth about health. So I am a chiropractor, and I've spent many years reading, learning, researching, and understanding the truth about what health is and how to help my patients implement that into their lives. Now, the reason I say truth is because as a society, I think we've really lost sight of what it takes to be healthy. So I really hope that I can share some of what I've learned with you and just make you think about ways to improve your quality of life. So 120 years. Now, if you knew this was possible, would it change the way that you do live your life? Would it change what you put into your body, how you move, think, and feel? Well, our cells are designed to continuously regenerate for 120 years. Apart from your brain cells and your nerve cells, which you keep throughout your entire life, every cell in your body replaces itself again and again and again. Now, in your liver, it does that about once every 5 years. In your skin, about once every 2 weeks. So why are we all failing to live up to our potential? And these are the leading causes of death in Australia in 2010. All of these diseases are chronic lifestyle diseases. They are caused by either a deficiency in what you need, so things like real, whole foods, movement and exercise, positive thinking, or they're caused by a toxicity in what will hurt you, things like processed food, sitting down for too long, drugs and stress. So those things actually speed up the rate at which your cells replace themselves. Now, these diseases have only been present since we industrialized our world, and their rates are skyrocketing. So obesity alone is up by about 600% since 1962. For the first time ever, some scientists think that the children in this generation won't be expected to live for as long as their parents. Now, our ancestors didn't have any of these diseases. Yes, they did die younger, but that was primarily due to one of two reasons. So the first one's infection. They'd get a cut maybe while out hunting and would get bacteria into their bloodstream, and there's no treatment for that. The other one is infant mortality. A lot more of their children and their mothers died during childbirth, and that really brings down life expectancy. There are actually some small pockets of human civilization, mainly in Brazil and New Guinea, that still mostly live in their natural environment and kind of untouched by our developed world. They don't have heart disease, diabetes, or obesity. They don't have any of those chronic health issues that a lot of our society does. The elderly members of the tribe are fit, strong, and healthy, whereas our society looks at our elderly as burdens on time and resources. These tribes value their elderly and they really relish in their wisdom. So again, why are we all failing to live up to our potential? Now, since the 60s, our prescription drug consumption rates have skyrocketed. We have more hospitals, more doctors, and more nurses per capita than ever before, yet we're getting sicker and sicker. We are the sickest species on the planet, and we're the sickest humans there have ever been. To put into comparison, the Black Plague wiped out about 30% of Europe, and chronic illness is now killing 80% of the industrialized world. America consumes 65% of the world's pharmaceutical drugs, and are the second most unhealthy country out of the industrialized nations. Do you know what type 2 diabetes used to be called? Adult onset diabetes. We had to change the name because our children began developing the disease. So why are we sick? Well, let's have a look at this scale. So on the left-hand side we have health. Homeostasis is the word for our cells acting and functioning as they were designed. Now every time you pick up that donut, you have an argument with your wife or husband, or you decide not to go for that walk, you move away from health towards sickness. Now, as you move further towards this side of the scale, your body starts making changes to adapt to the stress it's undergoing. So, we'll take high blood pressure as an example. High blood pressure is a symptom of disease in the body. It's the body making changes to adapt to the stress. So, high blood pressure is not the problem, that donut was the problem. Your body needs high blood pressure to function. If you go to the doctor and they determine that you have high blood pressure or cholesterol or triglycerides or lipid levels or whatever else, they'll give you a pill to lower that symptom. Now, will your blood pressure come down? Of course it will, because that's how drugs work. Every drug ever produced works by altering signal pathways from your body to your brain. They're designed to alleviate symptoms. When your blood pressure comes down, according to the doctor, they've done their job, but meanwhile your body still needs higher blood pressure to function. It needs blood pressure, up at higher levels, but the drugs are stopping it and your blood pressure is down lower. So the body becomes more stressed as it tries to raise blood pressure to the levels it requires. According to medicine, you don't even have a problem until your blood pressure is too high, which is generally about 130/80. So your blood pressure could be 129/80 and you're healthy, but as soon as it hits 130/80, you're technically sick because it's too high. Just that 1 millimeter mercury of difference and you become sick. Well, that's absurd. Health is not black and white. It's a continuum, and every action you perform either takes you towards health or away from health. So remember what I said, that disease is either because you have a deficiency in something you need or a toxicity in something that's bad. Well, do you think that drug is toxic? Of course it is. It's blocking signal pathways in your body, it's blocking signal pathways in your brain, you get serious side effects and then have to take another drug, and it's just a cascade of pharmaceuticals. One of the most popular diabetic drugs prescribed in Australia at the moment is actually banned in New Zealand and the UK because it has strong links to heart disease. Drugs are toxic and they take you away from health. Now, sometimes they are good because they do alleviate symptoms, but by that stage you're already so far towards this end of the scale in sickness and disease. So we really want to make changes to move you towards health and towards this side of the scale. So why do we look at sickness the wrong way? Well, I think it's because we as humans think that we don't conform to the laws of nature. So I heard this story recently about a mother who was with her child, and the child was trying to sneak some chips to her dog. And Mum turned around and said, "Oh, don't feed those chips to the dog, that's bad for him." Why are we feeding chips and soft drinks to our kids, but we're not going to give them to our pets? Why do we take the dog for a walk and we let our children sit and watch TV? We think we can live above the laws of nature, and we think we live in a concrete jungle. But in reality, it's a human zoo, and all the inhabitants are becoming sick, just like the animals in our real zoos. The animals in the zoos have depression, obesity, chronic health problems, and we say, well, they're living in a zoo. They've been taken out of their natural habitat with no space to run around. What would you expect? Well, as humans, so have we. We've been taken out of our natural habitat. The sickness is coming from our lifestyle choices, and we really need to accept that before we can make changes. I have 6-year-old patients come to me with pain in their back, pain in their knees and ankles, and maybe they have arthritis, and the doctor has told them that they should expect that. Arthritis is part of the aging process and they should expect that pain. Well, you're not going to find arthritis in those 60-year-olds in those natural civilizations in Brazil. Aging is not based on how long you've lived, it's based on the stresses that have been placed on your body. So if you think about whether maybe you have arthritis or someone in your family has arthritis, and if you think about, is it in all of your joints, or is it in all of that person's joints, or is it just in some of them? Now, if arthritis was based on how long you've lived, then you would expect arthritis to be in all the joints because all your joints are always going to be the same age. But they're not. So arthritis is based on the stresses that you place on your body. So to give you an example, let's say we have 2 ponds. They're exactly the same. We dug them on the same day, we used all the same materials and plants, and we put the same fish in each of the pond. Now with pond 1 on the left here, we fed it the proper nutrients it required, we cleaned out the algae, and we made sure the acidity was regulated. In pond 2, we threw our trash like McDonald's and KFC, we let it sit and stagnate, and we didn't allow the water to circulate. Now, after 2 years, the ponds might look exactly the same, but is pond 2 as healthy as pond 1? Well, of course not. After 10 years, you might start to see some changes. The plants in pond 2 begin wilting, the pond is aging more quickly, fish start washing up on the shore sick and dying. Now, do we say the pond 2 is sick because there aren't enough medicine and drugs in the water? Do we build little hospitals on the side of the pond and start giving surgery to the fish and removing some of their body parts? Of course not. We clean the water, we give the pond the nutrients it needs so that it can function on its own. So why do we think that our problem is that we don't have enough drugs? If that was true, the people who took the most medicines would be the healthiest. But in reality, the people who take the most drugs are the unhealthiest. Life on this planet is designed to take care of yourself if you give it the nutrients it needs and you take away toxicity. Now, this is a really tough one, but does anyone know, or can anyone guess where this town or where this picture is from? I'll give you another picture here. So, this is the town of Pripyat in Ukraine, right next to Chernobyl. This is actually the town where all the workers of the nuclear power plant lived. Now, this abandoned town is now one of the healthiest ecosystems on the planet. The trees have come back, the animals have come back, the creek has fresh running water. And just 27 years after a nuclear disaster, you take away nature's most deadly toxic influence, us as humans, and nature looks after itself. It becomes healthy again. So if Chernobyl can do it, so can we. So how does chiropractic help? Well, basically we acknowledge that the body conforms to the laws of nature. The body is self-healing and self-regulating. When you cut yourself, you might wash it with iodine and wrap a band-aid around the cut. After a few days you take off the band-aid and the cut is healed. Now, was it the iodine and the band-aid that healed the cut? No, it was the body doing what it was designed to do. So what controls the body and tells it how to heal that cut? Well, it's the job of the brain and the nervous system. Together they are the master control system of your body. They control every single organ, every single tissue, and every single individual cell in your body. They tell your body how to heal that cut, how to digest dinner that you just ate, how to move your arm, and how to fight off the flu virus when winter comes around. Now, remember how I said earlier that the only cells not to replace themselves are the brain and nervous system? Well, that's really important because it means we have to make sure that the nervous system is functioning properly so the body stays healthy and it doesn't move into a state of disease. Now, each of the individual little segments in the spine are called vertebrae, and they're designed to move, so allow you to move and allow your body to function. At every segment, a whole bunch of nerve fibers come out of these little holes in the spine, and they send messages from the brain to the body and back again. Now, what can happen in the spine is you develop what is called a subluxation. This means you have a little bit of decreased movement, and maybe the segment in between two individual vertebrae gets a little bit stuck. What this does is it causes pressure on the nerves coming out of that segment, and the message going from the brain to the body and back again becomes impeded. So kind of like when you get fuzzy mobile phone reception, just the message isn't getting through properly. So subluxations are caused by either a deficiency in what you need or a toxicity in what is unnatural, just like all other chronic health problems. All physical, chemical, or emotional stresses can cause subluxation. So things like poor posture and sitting down for too long, the way you carried your school bag as a child, bumps and falls, food filled with hormones, food filled with pesticides, drugs and medications, emotional stresses, these can all cause subluxations in your spine. Now look at this guy at the top right hand side here. He's wearing a full hazmat suit and even a gas mask to spray chemicals on the foods that then we're supposed to go and ingest. And it really makes you think, doesn't it? So a subluxation causes the nerve message to be impeded. Now, depending on where that nerve is will determine the effects that it has on the body. If there's a subluxation in the neck, you can get things like headaches, sugar cravings, fatigue, even immune problems. If it's in the mid-spine, you might get wrist and hand pain, difficulty breathing, gallbladder conditions, kidney problems, stomach ulcers. If you have a subluxation in the low back, you might experience constipation or bloating, pain of the bum or pain of the legs or low back. And often a subluxation is present for years before pain is even felt, because pain is a symptom. It's the body telling you that something is wrong. Only 10% of the nervous system is involved in sending pain messages to the brain, so pain is often one of the last symptoms to arise. Many subluxations are silent and you won't ever experience pain, so it just depends on where that nerve is in the body. So what we do as chiropractors is we remove the interference to the nervous system that is built up from all those stresses. This allows the body to self-heal and self-regulate. The adjustment is a very safe procedure and can be adapted to suit the patient. So for babies, we use about the pressure that you can put on your eyeball with your eyelid closed. Now, it's very important that babies' nervous systems are functioning properly, as about 80% of neurological development happens in that first year of life. Birth is actually quite a traumatic process, so if there's intervention through things like a C-section or forceps extraction or vacuum extraction, research suggests that 95% of babies will actually have subluxation or dysfunction in their upper cervical spine. And this is really easily corrected, especially in young children, so it's important they get their spine checked early. Now, in adults, the pressure used is a little bit stronger because scar tissue develops in areas of the spine that are subluxated. This scar tissue causes a further decrease in movement and leads to degeneration or arthritis in the spine, which can further compromise nerve flow. this degeneration is actually preventable, so the adjustment is very important to both increase movement in the spine and allow the nervous system to function properly. So along with chiropractic care to allow the all-important nervous system to be functioning properly, we also need to ensure we have sufficiency and purity where deficiency and toxicity exist. And it's usually a lot more simple than we make it. So doing things like eating fresh, local, organic fruits and vegetables, eating meats that aren't grain-fed, eating good fats and whole grains, drinking lots of water, while we limit our intake of things like sugar, bad fats, and processed foods. We need to exercise regularly and avoid sitting down as much as possible. We need to think healthy, positive thoughts and avoid stressful situations as much as you can. Now, behavior modification is quite hard because we act on how we think. So if we think, I want chocolate, what we do is we go and eat the chocolate. When we change that, if we think, I want chocolate, our action of the fact that we don't want to eat the chocolate and say I'm not going to eat the chocolate becomes quite difficult, and after a while you just end up eating the chocolate because you still think, well, I want to eat the chocolate. So behavior modification is hard, but with chiropractic care we can help. Chiropractors have been extensively trained in wellness and preventative care, making sure you're fighting fit throughout your life and decreasing your chance of developing a chronic disease. So just like visiting a dentist and practicing dental hygiene helps you look after your teeth, servicing a car helps you keep it running properly, chiropractic care ensures your nervous system is working properly and gives your body the best chance to take care of itself. Chiropractic patients spend less time in hospital, less money on drugs and products, and less needs for surgery, which is really good because a conservative estimate of 700,000 people died from properly prescribed drugs last year in the United States of America. So they were taking the doses that were supposed to take. 700,000 people died. Now, when you throw in the side effects from surgeries, the complications and mistakes that happen during these procedures, the risk is enormous, and we want to keep you away from the hospital as much as possible. So to help everyone take control of your health, what we're offering is a free consultation at our clinic on Queen's Parade over in Clifton Hill with me. So this includes a full history, orthopedic and neurological assessment, and x-rays if it's determined you need them, which is generally valued at $80. Chiropractic is covered on most private health insurance extras cover, and under EPC, the program from the government, you can get 5 treatment sessions covered by Medicare. So this isn't just for chiropractic, you can visit other healthcare providers as well, like acupuncturists, podiatrists, dietitians. But at the end of the day, health is our most important factor. Countless surveys suggest that we value health as our #1 asset, yet we don't look after ourselves like we should. And I think a lot of that is just because people are unaware of how to do so. We've really lost our connection to our ancestors who had all the knowledge of how to live naturally in our natural environment. So, I hope I've provided you with a little more information about how to make some informed choices. And if you give the clinic a call, our girls will be able to look after you. Thanks very much.